All right, we're back. Let's play a little bit of sound. I want to play for the control room. Maria Cantwell just putting up a graph talking about Senator Cantwell talking about where we are today versus where we used to be because of vaccines.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines, and you don't want to support that. You don't want to support that evidence. So, yes, the governors of the West, Washington, Oregon, and California, will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it.
All right, everyone's still here. Jeremy, I want to talk about why a graph like that is no longer trusted among some sections of the population. She puts up that graph and shows, look, people aren't dying from polio anymore. People aren't dying generally, until recently, from the measles any longer. They're not dying from infectious diseases because we have vaccines against those infectious diseases. Why today is there this surge of doubt that these vaccines mean anything any longer, they work, or maybe now that they're actually more dangerous than they are effective?
Right, because why would you believe a chart like that shown from a Democratic senator when somebody in your Facebook or Instagram feed is talking about how the vaccines are killing perfectly healthy children, right? I mean, it's this battle for people's minds and their attention that misinformation, unfortunately, is winning. And in a case like public health, the stakes could not be higher. And I think that is why you are seeing senators like Barrasso and Cassidy come out and really hold RFK Jr. to account, because they're not only physicians, but they know that they're smart enough politically to know that this is where the Republican Party gets into very tricky territory when they start undermining public health. This is what happened in 2020 with COVID. It was Trump's mismanagement of COVID was a big, big reason he lost re-election that year.
Isn't that risky now, today, still, with the way that social media has changed Americans' perspectives and their beliefs? I mean, we've always been conspiracy-minded. We've always been, skeptical of authority. That's not new for Americans. But the way that skepticism and those conspiracies are distributed, well, that's certainly changed.
Sure it has. Local media has collapsed. This is the thing we have to acknowledge. We don't do it very often. We don't recognize that we've gone through the most radical transformation in where people get their information in maybe history. Or certainly, you go back to when they developed the technologies that made this possible. And I remember in the town I grew up in, the local weekly newspaper, and it was a town of 970 people. The local weekly newspaper had vaccination schedules and stuff like that. And they explained it. And so your trusted sources of information were there with you, telling you about this. That's gone now. People are looking at their phone. They're getting whatever they're getting from different places. And it is important to understand that Robert F. Kennedy Jr. went out over the last many years. I covered him when he was running for the Democratic nomination. He went out over the last many years and spoke about these issues and built a base. Donald Trump wanted him in the team and supporting him in 2024 because of where he was coming from, not because...
No, because he could bring that base.
He could bring a little something. And the last thing I'll tell you is where this is going to matter is because we are going to become a patchwork quilt country. We are going to have states
but
where
viruses don't respect boundaries. They don't respect state lines.
But boy, what happens when you start saying, this state, you can come here, you can't go there? This starts to get really... We will enter into an era of I think, potentially vaccine battles where governors are issuing stronger and stronger orders, and questions about all sorts of travel issues and that come in. This is a very, very difficult opening. And I think some of these Republican senators, that's what they see. They see the chaos and the legal battles and everything that's to come.
Jake, so much of this is justified by COVID. And it's justified, but I think some kernels of truth here. And the White House will say that You know, that RFK Jr. is pointing out that the chronic disease is a problem for Americans now more than ever. That's true. But there's also COVID, and there were the masking recommendations that changed. There was the, you know, keep your kids home from school mandates that a lot of folks felt like went on a whole lot longer than they should have, especially as the science became clear that healthy kids were not as susceptible to really bad outcomes with COVID as other kids who have underlying conditions. As that science matured and it changed, people felt like the public policy surrounding it did not mature and change alongside of it. And there is a deep sense of anger and resentment faced at experts or pointed at experts because of it. And it sounds like this is what Congress is using, or at least RFK is using to justify what he's doing. And Congress is finding themselves in the position to have to nod along because of that resentment and anger that's out there across the country.
You know, and it's interesting to me, one thing that stuck out to me in this hearing is that RFK's retort to all of this is, okay, excuse me, Democratic Senator X, you've been up there for how long, and look how sick the country has gotten. As if, and listen, there might be some truth to that. Federal policy, of course, might or might not contribute to the health. It probably does in some way contribute to the health of the nation. But I wouldn't say that any individual senator or Congress writ large is responsible wholly, or even, you know, to a large degree to the nation becoming more sick. And listen, I think we are, although we are 5 years removed almost from the onset of COVID, I do think a lot of this is related to the fact that there's just that the coronavirus and the public policy around COVID has contributed to just a grave distrust in public health institutions, because people think if they got that wrong, well, they must have gotten a lot of stuff wrong. And then all of a sudden you have, you know, for lack of a better term, quacks who have no idea about public health, who are riffing on Instagram or on Twitter, dictating public health policy, and that's wild. I mean, let's just put it plainly. I mean, that's completely wild, and I don't think that's great public policy. But that is the political world we live in today, as Tim said. I mean, and Jeremy. It's like, you know, we're listening to people just riff, and they're not doctors, and they have an Instagram account with 1 million followers, and all of a sudden they're dictating public health policy.
Yeah, and this is why you should only give your kids meat. Your infants should just be meat eaters. Give them big humps of meat, and that's it.
Don't wear sunscreen, or, you know, when your kid has a fever, don't do this or don't do that. I mean, it's all kind of kooky.
The physical therapist who said that she'd evaluated Trump's medical records and concluded that he was going to die.
It's just,
and by the way, we have this on both sides, Katie. It's like people look at a photo of Trump and they circle his hands and they say, "Look at all the changes here." It's like, what world are we living in?
No. This is one issue where the extremes really do meet in the middle. But you have to understand and empathize with why people feel this way, because it is very convincing to see it on your social media. You do think, well, maybe there is something wrong here. Americans are sicker than they used to be. What are all these ingredients in my food? You know, I go to the store. What is all this stuff on the side of the packaging? Can this possibly be good for me? Maybe all I really do need to live a healthier and happier life is to, you know, smear, beef tallow all over my face. Maybe that's the cure to my wrinkles and my acne. I mean, listen, my teenage son was susceptible to that. We had to say, we don't want you smelling like beef in the house. Maybe it's not a good idea. But I get it. I get it. People want a cure. They want to fix.
So picky, Katie.
God. Don't miss that this is all playing out. This is all playing out right as school starts.
Yeah.
When people are thinking about vaccines.
It's you know, I know we're smiling and we're talking about the kooky stuff, but it is very dangerous. And I mean what I said at the top, which is your kid is on a vaccine schedule, and everyone here who has kids knows that, and they are not fully immune or protected from a virus until many years down the line. So even if you're trying to do the right thing by your kid to keep your kid as safe as possible, it's impossible if other kids are not doing it, and suddenly a virus, you know, pops up and then it spreads. It's scary. It's scary because, you know, you can talk about COVID and whether it is so dangerous to healthy kids, but measles is, and polio is, and a lot of other stuff, whooping cough, RSV, that is very dangerous. All right, everyone, Thank you.